So in the emergency department, in the trauma center, there are 3 patients that we know are more serious. They're actually being treated now. I think one's in the operating room. I think one's in the intensive care unit. I'm not sure where the 3rd patient is at this point. The other 8 are being evaluated to see whether or not they need to be admitted and what level of care they are. The patients 40 patients who are in the cafeteria right now being triaged, we anticipate most of them will be treated and released. They are minor injuries, but we want to make sure we're treating them. If they have a head injury, for example, they might need a CT scan. We'll make sure that they get that before they leave. But most of them look like they're minor injuries, and they'll probably be treated and released.
What kinds of injuries are you seeing?
Yeah, lacerations. I think somebody got hit on the head and they have a ice pack.
Lumps
lumps
and
and bumps, those kinds of
So
things.
you said you drilled for this before.